no pandemic. Media is the cancer.
People are going to die. They die no matter what.
I need a haircut. Yes. It's great.
For heaven's sake, open the barber shops. Open the hair salons. We need haircuts, okay? We gotta buy food. We gotta go to work. We gotta provide for our families.
When it comes to the pandemic, are you scared at all? Do you believe in it?
Yes,
I believe
we
it's
sure
real.
do.
Yeah.
Exactly, it is real.
We still have a right, I think, to work.
We have a higher power that we believe in that takes care of us, and I know that it's a real thing. The pandemic is a real thing. We do believe in that.
It's not
but
fake,
we want to work. We want to work. We don't want a government handout.
Almost none of the street protesters Thursday wore masks or physically distanced, as the CDC recommends.
No, we aren't. We're not scared of this virus.
God bless America.
Where's the circus? It's in that building right now. Where they're pretending that we need a social distance. Where they're pretending we need masks. They should wear the mask.
Are innocent until proven guilty, which means we do not need an immunity certificate. We do not need a test to prove that we're not vectors of disease and out walking around.
We want to open it up so we can make our own health. You don't need to be our deciding factor on when we go to the doctor. We can't get to the doctor right now because he got all clouded up with corona. It's not all about corona, it's about cancer. It's about all these other diseases and all these other illnesses. People being put on hold for surgeries and stuff because you need to open it back up and let us be our own choice, our own voice.
Can I see the back of your vest? This is Bikers for 45. He's the president of the Minnesota chapter.
If you can't make the choices for yourself, you no longer live in a free country. And right now, we do not live in a free country. We have to wait for permission from the government at many levels to be able to do something. Go out of the house, go shopping, gather in groups of 10 or more.
Men and women are tyrants! My husband and my son were confronted by the police last week for simply trying to make a living, all the while these politicians are being paid from our tax dollars! They are suffering! We are suffering! This is an uprising!
We have real-world examples. We had a church gathering here in Kansas that had 50 people infected, 6 deaths, and they went to 9 counties so far, and with the illness, and have been. That's how the spread occurred.
Have you considered the health ramifications of being in a large group of people?
Yes.
And that doesn't change your mind?
No.
Why do you think the doctors are saying that?
They don't have any choice. Of course they have to say that.
USA! USA! USA!
Unethical. Disgusting. You're a virus.
We're trying to do the right thing, and we don't need to get attacked. It's not fair to get attacked.
And a handful of nurses wearing masks, refusing to move.
Pictures of nurses and physicians with bruises on their faces and crying because they can't take another day of losing patients. It's just incredible that that doesn't seem to affect people.
And you say I don't have the right to stand here and debate you? Listen, honey, we can have a decent conversation. You can't without fighting. Stupid. Let's go. No, you can't fix stupid. I'm not sure your position.
Traitor!
it really feels like a slap in the face to medical workers. I get it. I don't want to be stuck in my house either. I don't think many people at all are enjoying this. That's not the point.
People die from all kinds of things every day. That's just the way of life. The people that are getting sick are the people that are already compromised in the first place. They're usually older, they're unhealthy. I'm sorry for them.
Unless we get the virus under control, the real recovery economically is not going to happen. So what you do if you jump the gun and go into a situation where you have a big spike, you're going to set yourself back. So as painful as it is to go by the careful guidelines of gradually phasing into a reopening, it's going to backfire. That's the problem.
Start trouble and everybody's going to end up going to jail. They won't just take you to jail and her to jail, they'll take everybody to jail and it'll be on your record for the rest of your life. Is it worth it?
We have a right to be here too.
And they're saying reopen PA with no testing. It's like they don't care about life. They don't care about the people around them, the people they love. I care about the people.
The president's policy says you can't start to reopen under his plan until you have declining numbers for 14 days, which those states and my state do not have. So then to encourage people to go protest the plan that you just made recommendations on Thursday, it just doesn't make any sense.
Much of this feels like a Donald Trump re-election rally at the same time. Many people coming out to support the president, many not wearing masks. Some are, but a lot of the people in this crowd right now are not wearing masks and don't have a particular concern about the coronavirus.
We are here exercising our God-given American rights, our Second Amendment, and we're here in support of firing DeWine, getting rid of him. He hasn't done anything for this state other than cause economic grief.
Everybody around the world is sacrificing, really taking on a lot of hardship to be able to flatten this curve and to reduce this slow spread. And it's kind of like deciding after you jump out of an airplane and you've pulled your parachute, if now that you've started to slow down, that you say, hey, I don't need this parachute anymore, and just cut the cord.
We are essential! We are essential!
Keep your voice down, please. Keep your voice down.
Because information about the virus should have been told to us earlier and a lot sooner. People knew it was happening and people did not want to talk about it. Many Americans are saying the exact same thing about you, that you should have warned them the virus was spreading like wildfire through the month of February instead of holding rallies with thousands of people. Why did you wait so long to warn them?
Who are you with?
And why did you not have social distancing until March 16th?
Who are you with?
I'm Weijia Jiang with CBS News.
So, if you look at what I did in terms of cutting off or banning China from coming in,
by the way, not Americans who are also
Nice and
coming
easy,
from China.
nice and easy. Just relax. We cut it off. People were amazed. These gentlemen, everybody was amazed that I did it. We had 21 people in a room. Everybody was against it but me. Dr. Fauci said, had I not done that, perhaps tens of thousands, and maybe much more than that, people would have died. I was very early, very, very early. And we just saw, you saw Brett Baer making a statement. They had a debate well into February, and not even mentioned, it wasn't even mentioned, the Democrats. We were very early. Oh, I'm the president. And you know what I just did? And you know what I just...
And by the way, when you issued the ban, the virus was already here.
Okay, and you know how many people, when I issued the ban, how many cases of virus were in the United States when I issued the ban? Do you know the number? No, how many cases? Remember I said one person. How many cases were here when I issued the ban?
Did you know?
No, you have to do your research. How many?
I did my research. On the 23rd of March, you said you knew this was going to be a pandemic.
Can I tell you what? I did know it. I did know it. All I have to do is look.
So you knew it was
Anybody knew it. Just, are you ready? How many cases were in the United States when I did my ban? How many people had died in the United States?
So do you acknowledge that you didn't think
Keep your
it was
voice down,
going to
please.
spread?
Keep your voice down.
Did you not?
How
think it was
many?
going to spread?
How many cases were in the United States? I did a ban where I'm closing up the entire country. How many people died? How many people died in the United States? And yet I closed up the country, and I believe there were no deaths, 0 deaths at the time I closed up the country. Nobody was there. And you should say thank you very much for good judgment. How many people had died in the United States?
So do you acknowledge that you didn't think
Keep your
it was
voice down,
going to
please.
spread?
Keep your voice down.
Testing and contact.
You're
Okay.
putting words in my mouth. I said, open up Las Vegas.
You want casinos open, Vegas back in business. Is that a responsible call to make?
Well, that's a piece of it. I want the hotel rooms open. We have 155,000 hotel rooms,
Right.
and most of our people who live here and are part of the population are hooked to those hotel rooms in some way or ancillary way.
So you want
And
like hotel
ultimately-
rooms, casinos, the theaters open? I mean, you want Vegas back in business, no?
I want our restaurants open. I want our small businesses open. I want our people back in employment.
But
And so it's all
casinos,
part
you
of
want
it.
them open because obviously visitors are not going to come without casinos and shows and things.
Well, no, they'll come because they love. We've got Major League Sports here, and
So
we've
you want
got so
stadiums
many
open?
answers. I'd love everything open because I
Okay.
think we've had viruses for years
that-
that have been here.
That is the call you said you weren't making. That is the call. You want casinos open, you want stadiums open, you want restaurants open, you want Vegas back in business.
And
I
Anderson,
understand
you're being
yeah.
very specific, and I appreciate it because that's where you're seeing it. No, the reality is I want us open in the city of Las Vegas so our people can go back to work. We've never closed down the United States. We've never closed down Nevada. We've never closed down Las Vegas because that's our job, an entertainment capital of the world.
I get the financial losses people are suffering, which is awful, but you're encouraging, I mean, hundreds of thousands of people coming there in casinos, smoking, drinking, touching slot machines, breathing circulated air, and then returning home to states around America and countries around the world. Doesn't that sound like a virus petri dish?
Know what it sounds like? You're being an alarmist. I'm not. I've lived a long life. I grew up in the heart of Manhattan. I know what it's like to be with subways and on buses and
I'm being an
crammed into
alarmist?
elevators. I think you are by saying what you have just said.
So you don't believe there should be any social distancing? You don't believe that this is
Of course I believe there should be. Of course.
How do you do that in a casino?
That's up to them to figure out. I don't own a casino. I don't know anything about building
Wait a minute. I'm sorry. You're the mayor of Las Vegas, and you want casinos to be open, even though you have no authority, thankfully, over casinos. But you say open them up, but you have no responsibility about how that would be done safely?
No, you're blurring. No, you're blurring.
You said it's not your job.
There. I am not a private owner of a hotel. I wish I were. And I would have the cleanest hotel with 6 feet figured out for every human being comes in there. Right now, we're in a crisis health-wise. And so for a restaurant to be open or a small boutique to be open, they better figure it out. That's their job. That's not the mayor's job.
Chinese researchers have shown how this virus spreads. And I just want to put up for our viewers. This is a restaurant.
Anderson, you are tough.
No, I'm not
We're
talking
back
about
to China. This isn't China.
Yeah,
this is Las Vegas, Nevada.
Wow. Okay, that's really ignorant. But hasn't it been because of social distancing that the numbers have been what they are?
How do you know until we have a control group? We offer to be a control group. Anybody who knows anything about statistics knows that, for instance, you have a vaccine.
You're offering
the
citizens of Las Vegas to be a control group to see if your theory on social distancing works or doesn't work.
Wrong. Absolutely wrong. Don't put words in my mouth.
You just said we'll be a control group.
Excuse me. What I said was, I offered to be a control group, and I was told by our statistician, you can't do that because people from all parts of Southern Nevada come in to work in the city. And I said, oh, that's too bad, because I know when you have a disease, you have a placebo that gets the water and the sugar, and then you get those that actually get the shot. We would love to be that placebo side so you have something to measure against.
You want to get the placebo. You don't want to get the actual. Well, no, the group who gets the placebo, by the way, usually gets the short end of the stick. I haven't heard you say yes, that you would be sitting on those casino floors every night along with the people that you say you are holding their hands with.
What is the purpose of that? First of all, I have a family.
Because it would be putting your money. It would be putting money where your mouth is, to use a Las Vegas term.
Anderson,
if you say it's safe,
Anderson.
Okay, so you're not willing to sit on the casino floors with them when they're reopened and breathe the refiltered air.
First of all, I don't gamble.
Dr. Fauci. Our next expert is Dr. Anthony Fauci.
Tony knows what to do.
Dr. Anthony S. Fauci.
Tony and I.
We turn now to Dr. Anthony Fauci.
Dr. Anthony Fauci.
Dr. Anthony Fauci.
Thank you so much, Dr. Fauci.
My name is Dr. Tony Fauci. I'm the director of the National Institute of Allergy and Infectious Diseases at NIH.
Even as a boy, Tony was distinguished by his courage. In a neighborhood full of Brooklyn Dodgers fans, he rooted for the Yankees.
So I was in an Italian and American section called Bensonhurst, and it was a very family-oriented, very warm, nurturing. My father is first generation. His father was born in Italy, came to the United States at the turn of the 19th to 20th century. They called him Doc. Back then, pharmacists were called Doc because many people who either couldn't afford to go to a doctor or didn't want to take the time of making an appointment would go in to their neighborhood pharmacy.
And he still quotes what he learned from Jesuit teaching: precision of thought, economy of expression. And now you know why he never ran for public office.
He was a great basketball player. Did anybody know that? He was a little on the short side for the NBA, but he was talented.
And graduated first in his class in 1966 at Cornell Medical College.
noted public health scholars were opining and even testifying before the United States Congress that with the advent of antibiotics and vaccines and public health measures, quote, the war against infectious diseases had been won. At that time, I was on my way to begin, of all things, a fellowship in infectious diseases at the National Institutes of Health. I sort of felt like I was going to Miami to be a ski instructor.
Before this malady even had a name, it had a fierce opponent in Dr. Anthony Fauci.
This is a new disease, at least in the United States.
Just struck me as an oddity that otherwise healthy men and another oddity, otherwise healthy gay men, got an infection that you virtually never see in someone with a normal immune system. And at that point, it was like, oh my God, we're dealing with something new.
I decided I was going to stop what I had been doing and devote myself completely to studying what I felt would be an enormously difficult disease. And it unfortunately turned out that that was the case.
And that's an issue that I really must emphasize over and over again, that there is no scientific evidence at all that it can be transmitted by casual contact.
One of the toughest decisions, I had a few, was when I made a decision during the middle of the early years of the AIDS pandemic to bring the activist community into our deliberations, because most of the scientific community, including my own staff, were totally against that.
But I think you have to...
If you start that business about science isn't done that way, I'm going to come down there and slap your face.
All right, Larry, hang on for a second.
Remarkably, he has gone from being burned in effigy by AIDS activists in the early days of the epidemic to winning their trust and respect.
You know, I want to say something about Tony Fauci, because I think the world must think I hate him or something, the way I'm going on tonight. I love Tony. Actually, I think I probably have a more complicated relationship with Tony than anybody in my entire life. He is a man, an ordinary man, who is being asked to play God. And he is being punished because he cannot be God. And that is a terrible situation to be in, to be the lightning rod for all of us. But he is there, and he has been this incredible fighter for us and for AIDS.
I love you, Larry.
How many presidents have you known personally?
Essentially all of them to a different degree. I knew President George H.W. Bush very well.
Who are the ones that you would point out to young Americans as figures who should inspire this country?
I think of Dr. Fauci. Probably never heard of him. Well, you did. Ann heard him. He's a very fine research, top doctor at National Institute of Health, working hard doing something about research on this disease of AIDS.
I didn't see the debate. I was out of town coming in on a plane, and the next morning when I walked into the NIH, as I walked into the lobby, people started going like this, and I said, what is this all about? I said, what do you mean what's this all about? The president called you a hero during a national debate that was seen by 100 million people, and I was totally surprised.
For his determined and aggressive efforts to help others live longer and healthier lives, I'm proud to award the Presidential Medal of Freedom to Dr. Anthony S. Fauci.
got to be quite close with President George W. Bush. He took a very keen interest in global HIV/AIDS and allowed me to be one of the architects of the program, which has now transformed HIV globally, the President's Emergency Plan for AIDS Relief, or PEPFAR. But we can end it as a global pandemic. It's within our grasp. It was started and sustained by the phenomenal work of our president, and we just need, as a society, to just take it over the goal line. And I think we can do it. I really do, Barbara. I believe we can.
Under 6 administrations, who has been the coolest president that you have worked with?
Well, there's not a chance in the world I'm going to answer that one. Leadership takes many forms, including the quiet leadership of example.
I said earlier today that I hope we can do this by Easter.
You don't make the timeline. The virus makes the timeline.
Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful.
The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
Now, you're 74.
Right.
How long are you going to work?
I'm just going to keep doing it until I'm not effective. And right now I'm as energetic and I believe as effective as I've ever been.
Fauci.